Now, before the break, we showed you the very latest on the coronavirus numbers and also discussed what is going on with the test kits as the U.S. plays catch-up. My next guest has written extensively about pandemics, including this one, and I'm going to quote from his recent piece in the Times about the outbreak and also, as a reference point, the swine flu 10 years ago. One lesson of that 2009 outbreak is the paramount importance of relying on information from scientific experts, not from ideological soulmates. I've been speaking to epidemiologists and other health experts, and they emphasize that in a crisis like the president is facing, the government must protect its credibility, and the public should rely on experts rather than partisans on either left or right. He is also the author, with his wife, Cheryl Udon, of the new book, Tightrope: America's Reaching for Hope. Nicholas Kristof, an opinion columnist at the New York Times, and thank you.
Good to be with you.
To that end, you've spoken to epidemiologists coast to coast, and you're getting a reference point about where they are and where their very near future may be, even we don't know the scope of the outbreak. But as we'll talk later on to this program, Italy is believed to be a week ahead of where many European countries may be, and then whatever time frame you want to put could be our arc. If not will be, but if we don't do draconian measures, might be. To that aspect, how prepared are the hospitals when it comes to ICU beds, when it comes to materials, and when it comes also to the doctors and the nurses that are obviously the front lines?
Well, I mean, the problem is that you can't adequately prepare for an outbreak of the kind that epidemiologists fear that we may be facing. Together with two Canadian epidemiologists, I did an online model of how the pandemic may unfold in the U.S., and that leads to a demand at peak of more than 300,000 ICU beds in the U.S. And now the U.S. has about 95,000 ICU beds, and more than half of them are taken up at any one moment. There is some flexibility in creating additional beds. We can put up little, tents here and there. We can turn regular rooms into ICU beds. We can delay elective surgery. But one of the real limiting factors is ventilators. We have about 72,000 ventilators in U.S. hospitals. We will need a lot more than that. And in Italy, we're seeing these tragic scenes of doctors having to determine who gets a ventilator and lives and who doesn't and dies.
It's triage, and that's how they're describing it. We spent a lot of time on the justifiable frustrations that we have of wasted time, that with the benefit of hindsight that we're not at the moment right now, of a wasted month, to maybe even arguably 2 months. That said, I heard the words again from Washington that they found religion and the kits are on the way. We're going to cut through all the red tape here. We're going to figure out a solution to do rapid testing, which I know you wrote about as well. Even if I give the benefit of the doubt, what do you need to see to believe that it's really happening? I know Big Pharma was behind them today and also members of the scientific community. What really needs to happen to say the president's promise of 5 million kits right around the corner?
What needs to happen is that our friends, when they have a fever and a cough and they call up to get help, they can actually get tested. And right now, I'm sure this is happening to you, to viewers, that they know people who have symptoms and they just can't get tested. And so it's encouraging to hear these sounds from the White House. Maybe down the road that will happen, but the doctors I speak to are enormously frustrated because they just can't get these tests. And, again, promising rapid tests is one thing. Let's see them in action. Let's see drive-through testing operations. Dr. Redfield from the CDC said the other day that he didn't like the idea of drive-through clinics because that would interrupt the doctor-patient relationship.
It's surreal, some of these conversations.
Yeah, and so, and then we have to figure out staffing on hospitals. Even if we get more ventilators, the technicians. One of the things we've seen in China and in Italy and in Iran is that doctors and nurses seem unusually likely to get sick and quite seriously sick. We don't know fully why. It may be because there's a dose responsiveness and they're exposed to greater viral loads. But we're going to have to expect huge loads on hospitals at a time when record numbers of doctors, nurses, physicians' assistants, technicians are sick, and that's going to be an enormous strain. I mean, hopefully none of this will pass, but we've got to prepare.
To that end, we saw what they did in Wuhan, where literally 100 million people were quarantined. We're seeing Italy, which is largely shut down. From the folks we speak to, do they believe that that is either the right course and inevitability here? You know, I love how in New York City, some schools are shut down, some aren't, as if we're separated by 100 miles. There's an interconnectivity here. It doesn't seem, if you're trying to restrict groups, but yet you're keeping certain other groups around, there doesn't seem to be a consistency here to a plan.
I think that's fair. I mean, there are basically two bases of evidence that we have in terms of what works. And one is what other countries have done. And I think the best examples of kind of plausible strategies that the United States might follow, we're not going to be Wuhan, but Taiwan and South Korea have both done a very effective job in tackling the virus. And one of the central elements to their approaches has been testing. That's one reason why testing has to be an important part of this, and really a public health approach, not just a clinical health approach. The other body of evidence we have is from the 1918 Spanish flu, and there's been quite a bit of research about what cities did, and there were cities like St. Louis, which is the model, which very early on they actually banned gatherings of more than 20 people, and they closed schools, and that saved a lot of lives.
And wasn't it amazing, in looking back to that pandemic, that the role that propaganda played? I mean, the Philly parade with the troops coming back.
Right.
Medical professionals warned what would happen, and they dismissed it with some frightening language that's common to what I heard here, and consequently here they had to do mass burials of more than 12,000 people. To that end, there are some haunting parallels between being honest and transparent as being the only way here that you can get the public on your side, because if they don't believe you, you don't have credibility, and the tough conversations that we might be facing here, they don't know who to believe at that point.
That's right. And look, this is a hard challenge for journalists, for government officials. You know, on TV and the public, they want answers, and nobody has good answers. You have to navigate this careful line between calling attention to real risks and without creating panic. I think it's pretty clear that the government missed the boat on that over the last 2 months. I hope that we'll get it right now, and that we'll be St. Louis and not Philadelphia.
And we're craving for the Dr. Fauci's of the world.
Yeah, we sure are.
At least, you know, when you hear it, even if it's a hard truth, you believe it to be the truth here, which is where we are. But anyway, Nicholas, I appreciate it. Thank you so much.
Good to be with you.
Up next, we'll transition from the situation on the ground in America to what our potential future might look like. A report from a doctor on the ground in Italy. He'll join us to describe what he is dealing with.